So the biggest triggers for triggering off migraine, albeit you've got to have a genetic tendency to have migraine, are hormones, and we've talked about hormones before. Stress doesn't have to be horrible stress, but just being busy. So you're the lady in her late 30s, for example, who's got young kids, is working full time, volunteers at the weekend, and has elderly parents to look after. So busy life. And then the migraine brain likes regular meals and sleep and exercise. So insomnia can be quite a trigger for patients and people who get migraine. So we ask people if they can try and keep their routines the best they can, make sure they're eating regularly. So absolutely, hormones are a big factor in migraine. We know that because ladies get migraine 3 times more often than men. The sex ratio is the same up until puberty, so boys and girls get the same incidence of migraine up to puberty, but then after puberty, more ladies will get it. So probably if you're looking at a young female population in their 20s and 30s, 1 in 3 ladies might get migraine. And we think it's to do with how the brain interacts with estrogen. So for example, when you have a period, you have a fall in estrogen levels just before the period, and that's recognised to be a trigger for migraine. We also know that for some ladies, pregnancy can be really helpful for migraine. So in pregnancy, they will have high hormone levels, but the hormone levels are steady and stable, and very often that can help. And then a group of ladies who can have quite a difficult time with migraine are ladies who are in the perimenopause, when hormone levels start to fluctuate up and down. And then the migraine brain doesn't like that change in hormonal levels, and that very often can lead to a difficult time for ladies during those menopausal years in their 40s.
Okay, so definitely the hormones affects the migraines as well. Is there any evidence that it affects the severity of the migraine? So if somebody's in part of their cycle, is that they're going to have a more severe migraine?
So absolutely, ladies who get menstrually associated migraine or true menstrual migraine, in other words, some ladies will get just migraine at period time, although that's relatively uncommon, where ladies will have migraine during the month, but when they get their period, that will be their worst migraine. So absolutely, it's very clear that the worst migraines are around period time. So for most ladies, migraine actually usually improves in pregnancies. Ladies especially who don't get the oral symptoms, the visual symptoms, the sensory symptoms, very often, once pregnancy develops into, after maybe the first 3 months and they've got stable or more stable hormone levels, migraine can get a lot better. Some ladies, though, the higher estrogen levels can trigger aura for the first time, and some ladies with aura will find that pregnancy is not helpful. Lots of patients ask me about food triggers, things like chocolate, cheese, and red wine. If someone says to me they've stopped chocolate and they've never had a migraine in their life, then that's fine. But actually, a lot of the triggers that we traditionally thought were triggers are actually probably migraine warning signs. So for example, you have chocolate on a Friday night and get your migraine on Saturday. But if you did functional imaging of the brain, where you're looking up to see which bits of the brain are lighting up, the migraine brain's already changing on Friday morning. So we think that some of those traditional food triggers are just migraine warnings where patients feel they need, for example, to get carbohydrates in the system because the brain's working really hard. Red wine can be a trigger for some patients, usually the next day, not immediately. So if you've identified something that you think is a trigger, it's worth avoiding it. But for most patients, it's more about that good, healthy lifestyle. And it can be difficult for people who do shift work, for example, who sleep and eat at different times, or people who travel a lot with business and jet lag. And sometimes some patients will find atmospheric pressure changes can be a trigger, and there's probably not much we can do for that. So in summary, in terms of migraine itself, complex brain disorder of sensitivity and sensory processing, and patients and people to look at whether they can put some routine into their lifestyle.